Good morning, everyone, and welcome to our 11th presentation on the Power of Population Data Science webinar series. It's my pleasure to introduce Vari Aiken and Dr. Sarah Cunningham-Burley, who will be presenting on a consensus statement on public involvement and engagement with data-intensive research. By way of introduction, Dr. Vari Aiken is a Senior Research Associate in the Newcastle University Business School. She is a sociologist whose research examines social and ethical dimensions of digital innovation, particularly relating to the uses of data and AI. Currently, Mari works on the EPSRC-funded FinTrust project, which explores the role of machine learning in banking, particularly in the context of automated lending decisions and whether these lead to bias and financial exclusion. Prior to joining the Newcastle University, Vari worked as a research fellow at the University of Edinburgh, where she undertook a program of research and public engagement to explore social and ethical dimensions of data-intensive health research. She held roles as a public engagement research fellow in both the Farr Institute of Health Informatics Research and the Scottish Health Informatics Program. Her work in this area has been influential in informing research and government practices and shaping emerging good practices around public engagement with data-intensive health research. Vari is passionate about public engagement with science and technology and is committed to finding creative ways of engaging members of the public in discussion around the future roles of data and AI in society. She has experience in a range of deliberative engagement methods, including citizen juries, deliberative workshops, focus groups, and coordinating a public panel. She is also a regular performer in the Cabaret of Dangerous Ideas at the Edinburgh Festival Fringe and has spoken about her research in shows at the Edinburgh International Science Festival as well as in stand-up comedy clubs. Dr. Sarah Cunningham-Burley is a professor of medicine and family sociology and dean of molecular genetic and population health sciences in the Edinburgh Medical School of the University of Edinburgh. She researches and teaches in a multidimensional environment, bringing social scientific perspectives and methods to understanding and practice in medicine, public health, and health policy. She is committed to public engagement in science and social science and embeds this in her research. She currently holds a Wellcome Trust Senior Investigator Award, Transformations and Translations in Patienthood, Cancer in Post-Genomic Era, jointly with Professor Anne Kerr at the University of Leeds, and is director of a new Center for Biomedicine, Self and Society, which is supported by a Wellcome Trust Discretionary Award. She led the public engagement research stand for both the Farr Institute of Scotland and the Administrative Data Research Centre in Scotland, focusing on using dialogue and deliberation to understand public perceptions and interest in data-intensive health research and using engagement to support good governments. In this capacity, she's worked closely with Dr. Vari Aiken and Carol Porteous. So thank you both for being involved in our presentation today. Without further ado, I'm going to pass the wand over to Sarah.
Okay, thanks very much, Anne. And hello, everyone who's on the line, and congratulations if you've got up in the before dawn, I think, for those of you that are on the west coast of Canada. So Vari and I are delighted to participate in this webinar, and we're going to talk about what in many ways I think for us has been the culmination of several years. Vari and I have worked together around kind of information governance in relation to data science, particularly as relevant to population health over several years, from the Scottish Health Informatics Programme through to the Farr Institute. And we'll explain why, during the course of the webinar, why a consensus statement was something that we worked towards and have in that process brought many more people who have also been directly involved in public engagement in relation to data science for health to try and then create traction, I think, around what we think is a very important component of governance. So next slide. So we're going to divide the presentation. I'm going to talk first, but first I'm going to provide some background as to why we got to create this statement, and then Vari is going to provide much more detail about the processes that were involved and what the statement came up with. And we hope in discussion we can then talk about what this means for future practice. Next slide, please. So first of all, it might be useful, although maybe unnecessary for this audience, to think about what is data-intensive health research. And so we take it to mean kind of any form of research that involves the collection of large amounts of data that will often be linked. So data that may derive from many different sources, for example, electronic patient record, administrative data, increasingly a wider range of biological and other kind of clinical data that might be obtained, and also data that comes well away from the kind of health and administrative sector through to, for example, social media data. And of course, this can be used, I think, as everyone who's here will know, for a range of different purposes. So research might be conducted directly to support clinical decision making, monitor drug safety, and increasingly, particularly in the era of precision medicine, developing a range of prediction models that will impact on the way in which care is conducted in the health arena. But we can also be used for audit and clearly for basic research that tries to unravel the range of factors that will influence health outcomes. So we've taken a very kind of broad brush I think, definition of data-intensive health research, but in so doing also try to kind of create some boundaries around what we mean by such research, and the reasons for that will become important when we talk about why we felt there needed to be a consensus statement on public involvement and public engagement with this type of research, or research that is generative from large amounts of data. Next slide, please. So the background to, I guess, our years of engagement in public engagement in relation to data-intensive health research and to the need for a consensus statement is that there is internationally significant interest in the social and ethical dimensions of data-driven innovation. I think initially, as increasingly a larger range of data were being used and the possibility to link those from diverse sources, but then moving much more into concerns around artificial intelligence in health, the development of predictive algorithms that will impact on care. So the whole kind of innovation process, I think, is one that many would consider fraught with social and ethical dimensions. So we can take that as, in a sense, as the bottom line, that there is overwhelming interest in social and ethical dimensions of data-driven innovation. How that interest translates into practice, I think, is a different matter and something that we'll go on to discuss. There have also been some significant controversies around data use or proposed use of data in terms of health research, and that some of these have challenged the assumption that there is both public support and unfettered support based on a kind of idealised notion of public benefit or public interest. And in the UK, as many people will know, this really constelled around concerns around the use of data through an organisation called care.data. So there is potential, and there are other examples of concerns around data use, specifically in relation to health data. But the wider context, of course, is concerns around the way in which data about oneself is increasingly open to use or abuse across a range of kind of cultural domains. Anyway, this overall has led to calls that we need to establish a social license for data-driven innovation, particularly in relation to its use and reuse for health in the context of health. And here, the notion of a social license is one that's taking that idea from completely different arena. Originally, I think it was created in relation to the mining and extraction industries, where one needs to create a situation of acceptance of standard practices and operating procedures. And that acceptance has to spread across the whole of society. Key stakeholders, employees, the researchers, governance, those involved in governance, and wider publics, if the proposed enterprise, in this case, the use of big data for health research, is to proceed in a socially acceptable way. And I think until recently, it's perhaps been assumed that there was such a social license, and it is only when controversies rear their head that there's a realization that perhaps we cannot assume that there is a social license for these activities. And one reason might be that actually the use of data for data-intensive health research challenges established norms of practice in relation to data use and reuse. And there needs to be more work done to generate or co-produce those norms. And this is one reason why we want to focus on public engagement and establish norms for public engagement as both a process that will help support the generation of a social license. So the social license would require new forms of legitimacy, probably new forms of credibility, and to build trust in the systems that are being put in place. Okay, next slide, please. So as I said at the beginning, Vari and I have been working together for several years on public attitudes, values and preferences regarding data-intensive research. And more recently, obviously we're not the only ones working in that field, in order to try and bring the diverse range of research that is being done internationally together, we conducted a systematic review of existing qualitative studies, probably in need of updating now since we had a 2013 cutoff for the responses that we were looking at. But we found 25 studies that have looked at public attitudes towards data sharing and data linkage for health research, and these came up with quite consistent findings across different contexts. Next slide, please. A busy slide, but some of you may have read the paper. But in terms of consistency, and I think not surprising, we found that there was widespread public support for data sharing and data linkage for health research, but this support was contingent, and it was contingent on a number of factors. And interestingly, consent is not a key factor here, but a sense that one has control over data, and consent is one way in which that control might be practiced, and other issues around confidentiality, the need for safeguarding and data security. But underlying those dimensions was that there had to be a sense that this would lead to public benefits. Now, that, of course, raises a whole other host of questions, I think, as to what public benefit means. And Vari and I have done some research with mini publics through deliberative events over the meaning of public benefit, where we found that the publics that we spoke to in these deliberative contexts endeavoured to try and juxtapose kind of scale and need. So in a sense, all of the public, the whole of society should benefit from health research, yet there are particular groups whose needs require specific attention, vulnerable groups, those who are ill, those who have specific medical conditions. And so an unsurprising finding perhaps is that public benefit should address both of those issues, wide scale and specific needs. But it was also really clear from how people talked about public benefit that they took into account the kind of wider structures of society. So although there was general support for health research, partly for its own sake, so in other words, knowledge was considered to be of value, they attached enormous importance to then doing something about that knowledge and having a society where the beneficial results would be evenly spread in some ways. So some kind of appealed to sort of notions of justice, although those terms were not necessarily used. But going back to the systematic review, we found that many of the studies that we looked at necessarily focused on trust, and that where trust was considered to be lacking, the issues that were raised were around the abuse or misuse of data, concerns about the future in terms of how data may be used, concerns that if you're beginning to aggregate data on a massive scale, that might make findings far removed from kind of individual need, and concern about surveillance and the potential for data being used for political purposes, which we already know has happened. And some concern also that large-scale data analysis, where people then become categorized into groups, may lead to increased stigma and discrimination. So really some quite sophisticated arguments in the papers that we looked at. Next slide, please. So coming back to the idea of a social license for data-driven innovation, clearly public interest and public preferences are essential if we are going to produce both nationally and internationally the sense that going forward with data-intensive health research is something that is socially acceptable. And I won't go through the slide in detail, but we argue then that public involvement and engagement are absolutely essential in terms of underpinning such a social license. So the range of so-called stakeholders that need to be involved and whose voices need to be expressed and listened to has to be extensive. But the best ways to go about doing this are through some quite intensive forms of engagement. Next slide, please. So what is public involvement and engagement? And again, I'll be very quick so that Vari can take over to talk more about the consensus statement. Arguing that engagement should be both extensive and intensive, we are aware and in prior publications have broadly categorized public engagement into three different areas: awareness raising, consultation, and empowerment. And of course, these areas overlap. So public engagement is often done best when those that are engaged have the opportunity to become more knowledgeable about the issues that are under investigation, even though they don't need to have that knowledge prior to becoming involved in deliberation. But we're also very keen in this process to separate public involvement and engagement from what might be more traditional approaches to science communication or public relations. Now, they may be important for other reasons in relation to data-driven health research, but if we're thinking about involvement and engagement with the goal of creating a social license, then that engagement has to be authentic and meaningful, and not simply a way to convince publics that what is being proposed is a good thing. So next slide, my last slide. Relatedly, we argue that engagement should happen at different times and should take place at different scales. And this could be as diverse as wide-scale public conversations about uses or potential uses of data in health research, citizens' assemblies, those types of things, more intensive public involvement and engagement to co-design the development of policies and governance in relation to health research, and then engagement around very specific research projects that could involve a very wide range of researchers, and engagement of ensuring that the results of research will actually support improvement in health and healthcare systems. So thanks very much, and I'll hand over to Vari now for the second half of the presentation.
Okay, thank you, Sarah. Yes, as Sarah said, I'm going to speak a bit more about the consensus statement and about the process through which we developed the consensus statement. But I'm going to start by outlining kind of why we feel that this consensus statement is necessary, why we decided to develop this consensus statement. And as Sarah's already mentioned, there's public involvement and engagement is increasingly a part of the contemporary landscape of health research and healthcare innovation. So there's increasingly commitments to public involvement and engagement, and we see this at a number of levels. So this is in policy, it's in commitments from funding bodies, and also in commitments of research institutions and research projects. So there's increasingly vocal commitments to public involvement and engagement. But what that looks like in practice, or how those commitments are enacted, is quite varied. So there's not a great deal of consistency around the particular practices or how public engagement is pursued. So we feel it's important to develop principles to underpin future approaches to public involvement and engagement, to move beyond that rhetoric and to think about how we actually enact that in practice. It's particularly important because, as we've seen from previous controversies around other areas of science, technology and innovation, where there have been commitments to public involvement and engagement, the public engagement that's actually happened has often been criticised either for being tokenistic or for being cosmetic. So for not really giving members of the public a voice or an influence, or not really leading to impact. So as data-intensive health research is emerging as a new area, and it's quickly evolving and developing, and as we're realising the importance of developing a social licence to underpin these new forms of research and to ensure public support going ahead, we need to ensure that the momentum for continuous innovation is met with meaningful commitments to public engagement, which are enacted in ways which really lead to impact and which can maximise the value of public engagement, both for data-intensive health research as well as in terms of producing benefits for wider society. So we feel it's really, really important to have this set of principles to underpin future best practice in public involvement and engagement with data-intensive health research. Now, I should stress that this consensus statement is not about setting out methods or particular approaches to public involvement and engagement. We're not prescribing particular methods to be used, but instead it's about identifying principles to underpin those methods, or to underpin decisions around how to develop public engagement or how to evaluate public engagement. So it's about principles rather than methods. Also, I should stress it's really important that we're continually thinking about public involvement and engagement on an ongoing basis. So this isn't a one-off thing. It's not about developing a social license which would then be fixed or permanent, but realizing instead that public values and public responses will be continually evolving and adapting in response to changing contexts and changing events. So we need to think about how a social license would be established, but then also renewed and maintained on an ongoing basis. So public involvement and engagement needs to similarly be ongoing, and also needs to be able to adapt to changing contexts and changing events. So the principles that we outline in the consensus statement aim to underpin public engagement, which can be adaptive and which can evolve. So for that reason, again, it's not setting out methods, but instead setting out principles. So I'll go on to discuss about how we developed the consensus statement and how it was produced through the consensus process. So it started with a workshop which was held in Manchester in the UK in April 2017. And this is a consensus workshop which was organised and facilitated by the Far Institute public engagement teams. So myself and Sarah worked in the Far Institute Scotland Centre, but the Far Institute was a network of research centres across the UK. So there was a centre in Scotland, there was a centre in the north of England based in Manchester, one in London and one in Wales based in Swansea. And each of those centres had a public engagement team. So the consensus workshop was organised by collaboration across these 4 Far Institute public engagement centres and facilitated by the Far Institute public engagement teams. So at this workshop, we aim to bring together international practitioners and researchers with interests around public involvement and engagement with data-intensive health research. So participants were identified through literature searches, through reviews of current practice and current studies in these areas, as well as through contacts through our own networks and networks of contacts. So we identified individuals with a variety of expertise in relation to public involvement and engagement, or expertise in public attitudes or public preferences around data linkage and data sharing in health research. And this resulted in 31 international participants coming to the workshop in Manchester. So as I say, those participants included practitioners, included policy stakeholders and academics who were principally social scientists, but it also included representatives of each of the 4 Far Institute public panels. So as I say, the 4 Far Institute centres each had a public engagement team, and each of those teams coordinated a public panel, so a panel that was made up of members of the public and patient representatives. And there were representatives of each of those panels within the consensus workshop. We aim for the consensus workshop and the consensus statement to be international. So we have participants from the UK, from Ireland, Australia, Canada, Finland, and the Netherlands. So it's an international group. Of course, we can't claim to be truly global, but it is international. Now we aim for the consensus statement to be of international relevance. So at the workshop consisted of a series of small group facilitated discussions and wider plenary discussions bringing together all participants. Through those discussions, we aim to explore people's experiences of public involvement and engagement, to explore what challenges people feel are currently facing public involvement and engagement. We examined ideas of what constitutes success in public involvement and engagement, so what it is that we're aiming for public involvement and engagement, and finally how that could be evaluated. So what would it mean for public involvement and engagement to be successful, and what are the markers of success that we should be looking for? So following the workshop, the small group discussions were recorded and transcribed, and the plenary group discussions and detailed notes were taken. So following the consensus workshop, these notes were put together, and we conducted a thematic analysis to look at key themes that were emerging through these discussions, to identify the key themes coming out and the important issues to consider in thinking about how we develop best practice in public involvement and engagement with data-intensive health research. So following the workshop, a report was produced, which was then circulated around all participants for further feedback and input. And from there, a group from the Far Institute Public Engagement teams developed an initial draft of the consensus statement. And I should stress that the consensus, although we have reached consensus, which is produced in the consensus statement, consensus wasn't a straightforward process to get to consensus. We had a diverse group of practitioners, of researchers, and a variety of people with different perspectives and different experiences of public involvement and engagement. So essentially, we were aiming to reflect this diversity of experiences and diversity of perspectives, and to identify and establish what are the core principles that underpin those experiences and the core principles that we can agree on as being important for shaping public involvement and engagement. So through developing iterative drafts of the consensus statement, we were able to develop and refine this to establish what are the core principles that we can agree on and to identify where consensus lies. So this was a process that took about a year through developing and refining iterative drafts with consultation and input from all co-authors, from the 31 participants from the consensus workshop. And finally, to reach a consensus statement, which identifies the core principles that we feel as a group should underpin future best practice in public involvement and engagement with data-intensive health research. And this is the consensus statement, which was published earlier this year in the International Journal of Population Data Science. And it sets out our position on why we consider public involvement and engagement with data-intensive health research to be important, why we consider that it requires special consideration, special attention, and then what are the core principles that should underpin future best practice in this area. So this next part of this presentation, I'm going to discuss kind of the key points in this consensus statement and set out our position for what we feel is important to take forward. So firstly, we aim to set out what it is that's special about public involvement and engagement with data-intensive health research, and why it is that this area requires special attention or special consideration. Now, as I've already said, the consensus statement isn't aiming to set out methods or to prescribe particular approaches that should be followed in conducting public involvement and engagement, but instead it's to think about what are the particular features of data-intensive health research that make public involvement and engagement in this area worthy of special consideration. So the methods that are used in this area in terms of public involvement and engagement might not be significantly different from other areas of health research or other areas of policy, but there are key features of data-intensive health research that make this area different and make it worthy of special consideration. The first of these relate to scale. And this is true of many areas of data-intensive research, not just health, and data-driven innovation, where the scale that we're operating at is so large that it raises important questions about who it is that we should be engaging. So while in more traditional forms of health research, there might be a clearly identified patient group, or there might be a group of patients or a population whose data is used in a study or whose involvement is required in a study, which makes it easier to identify who it is that should be engaged or who might be involved in that project. But when we're looking at data-intensive forms of health research, the scale of data is so much larger. And at times this research is using data from very large populations or whole populations, where it would be impractical or even impossible to engage that whole population. So it raises important questions about who it is then that we should be engaging, and whether or not we should actually be trying to reach everybody whose data might be used. Is that possible? And what would that look like in practice? And if it's not possible, then what are the different approaches that need to be taken to address that? Secondly, public involvement and engagement has a role to play in bridging the gap between data scientists and data subjects. So while in other forms of more traditional health research, researchers may have more involvement or more contact with the data subjects or the participants in that research. So for example, when you think of clinical trials, a researcher is more likely to have contact with participants in that study, or more awareness of how the research that they're doing and the data that they're using relates to the lives and experiences of patient groups. When we're looking at data-intensive forms of health research, very often data scientists might have no contact with the people from whom that data originates, so the subjects of the data, the contributors of the data. And so it's really important that data scientists have an appreciation of what that data actually means, how it relates to people's lives, and what the impact of the research might be on those patient groups. So in that sense, public involvement and engagement can be a really important mechanism to connect data scientists with the people whom that data comes from, to help them to think about the ways that the data relates to people's lives, which is important in thinking about how we might pursue public benefits from that research, as well as thinking about or having an appreciation of the potential risks or potential harms, potential risks around data use. Public involvement and engagement can also have a role to play in bridging a gap between members of the public and the data about them. So while I feel certainly from our public engagement work, we found that members of the public are increasingly very aware that data is being collected about them, data is stored and it is being used for a variety of reasons. And there's increasing awareness or expectation that data is being collected in interactions in public life and in terms of service use and also in the private sector. But even so, members of the public very often aren't aware of what does data actually look like, where is it collected, how it is used, or what the potential outcomes of that data use might be. So while people are aware that data is collected, they don't really feel a connection to that data or know what it is being used for. So again, public involvement and engagement has an important role to play then in bridging that gap between members of the public and their data, in raising awareness, but also empowering members of the public to make informed decisions about how the data is used, or to become more involved in research processes and governance processes, and to have a role within those processes. Again, as we've already said, public involvement and engagement has an important role to play in establishing a social license for current and future practices. And this is particularly relevant since in many cases the research that is being conducted is being conducted without explicit consent of individuals. So while legally we might require explicit consent when the data that we're using is large-scale anonymous data sets and often aggregate data, but at the same time members of the public often feel a connection to their data or a sense of ownership over that data. So we need to think about, in the absence of explicit control, explicit consent, how do we facilitate a sense of control, and how do we ensure public acceptance or public approval of current and future practices? And again, public involvement and engagement then has an important role to play in establishing a social license. Finally, data-intensive health research as a new area and a fast evolving area is an opportunity to develop new approaches to public involvement and engagement. And it's particularly relevant because here public involvement and engagement takes a different form or serves different purposes compared to more traditional forms of health research. So while previously public involvement and engagement might have been seen as in terms of, say, clinical trials or other forms of health research, it's a way of ensuring participation or maintaining participation in health research. In this case, there isn't such a direct or kind of instrumental rationale for public involvement and public engagement in data-intensive health research. Instead, the rationales for public involvement and engagement are more substantive or more in terms of thinking about broader concepts and broader reasons for public engagement. So it's about facilitating transparency, it's about developing a social license and thinking about the relationships between science and society. And I think as data-intensive health research is emerging and evolving as a new area of research, this is an opportunity to develop new approaches and to establish a deeper understanding of the role of public involvement and engagement, and potentially be an exemplar. So that's why we consider public involvement and engagement in this area to be worthy of special consideration. I'm now going to go on to outline what we set out as being the core principles that underpin future best practice in public engagement with data-intensive health research. So firstly, public involvement and engagement with data-intensive health research should have institutional buy-in. And this is absolutely essential to ensure that public involvement and engagement can lead to impact. Because while there are increasingly strong commitments to public involvement and engagement, we need institutional buy-in in order to ensure that those commitments go beyond rhetoric and actually include meaningful commitments to act on the findings or recommendations of public involvement and engagement. And here we mean institutions at a variety of levels. So that includes at policy level, it also includes funding bodies, research institutions, individual research programs or projects. And institutional buy-in also involves, is also needed for support for training and for funding to support and underpin public involvement and engagement. The second principle is that public involvement and engagement should have clarity of purpose. And again, this is absolutely essential. It's essential to ensure that we're setting realistic expectations of public engagement processes. That's important when we're thinking about inviting people to take part in engagement processes. We need to be able to tell people what the purpose of that is and what might change as a result. It's also essential for enabling transparency, to be clear about why we're doing this and what the goals of public involvement and engagement are. But importantly, we also need to be open to the possibility of the purpose of public involvement and engagement changing through the process. So it's not about setting a clear purpose at the beginning and sticking with that. But if through that process we find that actually public involvement and engagement might serve different kinds of objectives, or that the interests of members of the public who are taking part suggest that the purpose is maybe not quite aligned with their interests and values, that should change. And there should be clarity around the possibilities of that changing and transparency around the ways in which it does change. So relating to that then, public involvement and engagement should be transparent. And that requires transparency both about the public involvement and engagement, about the purposes of public involvement and engagement, as well as transparency about the data-intensive health research that it relates to, and transparency about how those two things interact and the opportunities to change and impact. That requires openness, and it also requires accountability to the public about what's happening to data about them and how decisions are being made, and also transparency about the ways that they can become involved and the roles that members of the public can play. And before, public involvement and engagement relating to data-intensive health research should involve two-way communication. Now, as Sarah's already said, that we consider this to be a key characteristic of public involvement and engagement, in that it needs to go beyond simply awareness raising. Awareness raising has a role to play in terms of informing or enabling dialogue and discussions, but it shouldn't just be about communicating about what's happening, but actually facilitating discussions and facilitating dialogue and enabling two-way flows of information. And that's what sets public involvement and engagement apart from communications or public relations approaches and methods. Within that, we also need to be clear that this is about a conversation. So we're not trying to put out one-sided information, but we're enabling a debate or enabling dialogue. So through those processes, consensus isn't necessarily the key outcome. We don't necessarily want to lead to everybody agreeing, but actually we want to, public involvement and engagement should be a way of articulating and enabling diverse positions and perspectives. And within that, diversity and disagreement are key features. So actually public involvement and engagement shouldn't be aimed at manufacturing public support or leading to particular outcomes, but actually facilitating open discussions that allow us to explore and identify public concerns, public interests or preferences. Next, public involvement and engagement should be inclusive and accessible to broad publics. So here we mean it should be open to diverse groups of members of the public. We should ensure that it's accessible, and that means physically accessible in terms of thinking about how we're holding events and how we're holding meetings so that everybody is able to attend. Things like using accessible buildings, things like paying people, providing the means for people to come where they have childcare needs or other caring needs, but also being inclusive in terms of ideas and viewpoints. So again, this isn't about aiming for consensus, but actually we should be enabling discussion and discourse. So that means also being accessible to people from different viewpoints, even when those viewpoints might be challenging of the project or the endeavour that we're discussing. So we need to be inclusive in a broad sense and accessible to broad publics. And think about how the approaches that are used in public involvement and engagement relate to people's experiences and what it means to be accessible. So for some people, meetings or formal processes that feel comfortable and accessible to certain groups might not be so to other groups. So we need to think about in broad terms how we can adapt and change our approaches and methods to enable different groups and different people to participate. And number 6, public involvement and engagement should be ongoing. It's really important that public involvement and engagement isn't seen as just being one-off activities, but instead we need to think about how we develop and incorporate public involvement and engagement throughout research processes and throughout the life of research programs. It's particularly important because as data-intensive health research develops and evolves as a fast-paced field, so public responses and the conditions to underpin a social license are going to evolve and adapt. So public involvement and engagement needs to be ongoing in order to continually reflect and address concerns, reflect interests and preferences, and to feed into research and governance practices as these evolve. Number 7, public involvement and engagement should be designed to produce impact. Now, as I said at the beginning, in terms of the importance of institutional buy-in, it's really important that public involvement and engagement is able to effect change and have an impact. So it shouldn't be tokenistic or cosmetic, but actually it needs to have a clear purpose, and it needs to have to give members of the public a voice, to give them an influence. So it should be designed to do something and to change something. But this requires real commitment to act on the findings, or to act on the output from public involvement and engagement. And it needs mechanisms in place to enable that change and to realise impact. So that's where it needs to be connected to institutional buy-in and to have strong relationships with the institutions and the bodies who are able to act on the results and outputs of public engagement. Impact can mean different things. So that might be creating impact or creating change in terms of a data-intensive health research project or a programme or a policy. But it might also be in terms of creating impact in reshaping future public involvement and engagement, or shaping the future role of members of the public, or the ways that they can be involved in the future. So it can mean different things, but it's really important in designing public involvement and engagement that we think about the kinds of impact that might come out and the mechanisms that need to be in place to enable that impact. Finally, public involvement and engagement needs to be evaluated. And this is absolutely crucial, particularly since public involvement and engagement remains an area which is developing, and as approaches are developing, and we think about how best practices emerging and being developed. So we need to have a body of evidence that enables us to reflect on this, to further develop best practice, and to create a body of evidence which also demonstrates the value of engaging the public and the value of public knowledge within these processes. That in turn can feed into and reinforce institutional buy-in that we need to underpin this. So evaluation is key, and building up a body of knowledge to demonstrate the importance and to demonstrate the impact of public involvement and engagement. So these are our 8 core principles. And the key message that underpins all of this is that our key premise is that the public should not be characterised as a problem to be overcome, but a key part of the solution to establish socially beneficial data-intensive health research for all. And I think this is a really important message. Perhaps in the past, public involvement, public engagement has often been approached as being kind of about avoiding negatives. So it's often been seen as being a response to, say, public controversies or potential public concerns around uses of data. And public involvement and engagement has often been characterised as about addressing or avoiding public opposition or avoiding public concerns in the future. But actually, public involvement and engagement is a very positive activity, and it's not simply about avoiding negatives, but actually it's about engaging with members of the public to improve and strengthen research and governance processes, and to ensure that that data-intensive health research can maximise its benefits across society. So it's a very positive approach about harnessing public expertise and harnessing public knowledge for wider public benefit. So what does this mean for future practice? So we feel that the principles set out in this consensus statement should guide future approaches to public involvement and engagement in data-intensive health research, and guide decisions around the design and implementation and evaluation of public involvement and engagement strategies and activities. So it's, as I said, it's not about setting up particular methods or approaches, but instead having a set of principles that could be reflected on in choosing and designing public involvement and engagement approaches. So we feel that adherence to these principles will enable a meaningful role for public involvement and engagement, which is essential to establish and maintain a social license for data-intensive health research now and in the future. So we want to think of members of the public as partners and not passive recipients of data-intensive health research. We need to think about the ways that members of the public can be involved in these processes and have an active role. I think it's been said many times before, but while people working in this area, where data scientists or professionals, practitioners, are able to answer the kinds of questions about what we can do with people's data and what's possible in terms of data-intensive health research, it really is only members of the public or wider society who can answer those questions of what we should be doing and what we shouldn't be doing with people's data, and how we can maximise the value and benefits of that across society. And for that, public involvement and engagement is absolutely essential. But we need to ensure that that involvement and engagement is enacted in meaningful ways and can lead to meaningful impact. So we hope that the consensus statement will be used in a reflective way. We hope that it will guide practice as the field evolves. And we also hope that people will reflect on it and engage in discussions around the value of the statement and the value of these principles to promote best practice nationally and internationally. And so this is really the end of the presentation, but I'd like to encourage others to engage in discussion around how we can ensure that this consensus statement is adopted by relevant institutions, how we can ensure that institutional buy-in to develop strategies and efforts to realise the value and the benefits of public participation, public involvement and engagement in data-intensive health research. Thank you very much.
Thanks very much, Vara and Sarah, for your excellent presentation. I really appreciate you sharing the research and all that you've done to put this initiative forward. The floor is now open to questions if anyone who's online would like to ask questions. And just while we're waiting for people to use the chat function, if they have some questions, I had one. In particular, you've talked a lot about the importance of acting on the input from public engagement. And I just wonder, over the time that you've worked on this initiative and your experience, if you could maybe speak to a couple of good news stories in terms of things you were able to act on in terms of the feedback that you got from public engagement initiatives.
A really good question, and it's quite a hard question to answer. One, because it is often very difficult to pinpoint what difference you've made, and I think it's partly because the contribution could be, small ripples that will gradually grow as they spread out. And so I think over the course of doing this work, we have enabled a culture of engagement, I suppose might be how one would describe it, and kind of sets of expectations that all those involved in data-intensive health research have themselves become more aware of the need and value of public engagement. But that doesn't answer your, in a sense, a kind of more specific interpretation of your question. So where exactly do we think we have made a difference? I can give one example, but it's from a kind of earlier stage where I was involved in public engagement around building a new genetic cohort, Generation Scotland, in Scotland. And the public engagement work there, along with work that the academic lawyers were doing, created an approach to benefit sharing that was incorporated into the governance of that database and the kind of access that would be allowed. So there were arrangements put in place that there would be some quite specific benefit sharing that would come back to healthcare organisations. I think in relation to the development of health-related data science supported in the UK through the FAR Institute and now the Health Data Research Institute is of that slightly broader change in culture. and as we're hoping through the consensus statement, some change in institutional practice. But Vari might have some more specific examples to make here.
Yeah, and I think certainly the issue of culture change is a big one, and I think that's where I think we certainly have had impacts and made change in terms of increasing the value in a public engagement and the attention that it's receiving and the importance that it seemed to have. There are also some more specific examples of, one thing that we did within the Fire Institute was coordinate these public panels. These are panels of members of the public and patients who met on an ongoing basis to discuss the work of the Fire Institute and to engage with Fire Institute researchers to provide input and provide feedback on research proposals or on actual research and outcomes of research. And when these panels met, we invited Fire Institute researchers to come along and discuss their research. And often we invited people to discuss proposals that were being developed. And the idea was to get input at an early stage to enable the input of public panel members to shape research proposals and to shape the kinds of research questions that were being asked and what they might look like in practice. Often what actually happened was that researchers came with very well developed proposals or research that was already kind of getting going and really didn't, I guess, weren't quite at a stage where they were looking for substantial input like that. But what happened in that process is that researchers would come and they would come and present the research, and then the panel who were a very active, very engaged panel, would provide their perspective, provide their insights, and some really challenging questions often and challenging viewpoints. And actually those researchers would then go away and say, wow, like I came to present my research, but actually next time I'm going to come right at the beginning of the process, because actually having been through that process, they realized that there was incredible value in engaging earlier to actually shape processes and to shape the kinds of research questions and approaches that were being pursued. And for me, that was a really, really positive impact, because actually it was about changing the way that those researchers were viewing public engagement and increasing awareness and recognition of the value of public input and the value of public knowledge to shape research and to inform the ways that they were approaching their research. So I think that's an example of the culture change. And that's happening at a variety of scales. But the more that we do this and the more that we can demonstrate the value of public engagement and demonstrate the value of public knowledge in those processes, the more it kind of strengthens those commitments to public engagement and the impact that it can have.
Yes, thank you very much for your thoughts on that. I really appreciate it, and I know the audience will as well. It sort of underpins your earlier comments about how public engagement shouldn't be seen as a problem or a cumbrance, but more to actually support very positive initiatives. And so I think what you're saying as a great example is that researchers came to the table and had that experience, had to see the value of public engagement as supporting their research in a very positive and meaningful way. So I think that's great to hear. I don't see any other questions through the chat function at the moment. Maybe people are a little shy, but we do have your emails up, and thank you, Vari, also for your Twitter handle, so people can certainly feel free to send you independent questions as well. And I'd like to, again, thank you very much for your time today, sharing your research and also providing an excellent resource for people to reference on our collective websites in the future.
Okay, it's a pleasure. Thank you very much for inviting us.
Thank you.
Yes, thanks very much, both of you, and hope to hear from you again in the near future.
Yes, I'm sure.
Okay, bye for now.
Bye-bye.